Can sleeping sickness be transmitted sexually? Can it also be deadly if left untreated? Let's talk about it. You are most welcome to this channel, The Sleep Movement by Brilliant. From a single simple bite of a tsetse fly on an infected individual, the sleeping sickness cycle begins. When it sucks blood, it also sucks parasites which go on to accumulate in its gut. After 20 days, the parasites migrate to the salivary glands. The tsetse fly is now ready to infect the next victim on the next bite. Also known as human African trypanosomiasis, the sleeping sickness is caused by two main parasites. The first one being the Trypanosoma brucei gambiense, and the second one being the Trypanosoma brucei rhodiense. The rest of the Trypanosoma brucei parasite mostly affect animals, but only occasionally affect humans, with the Trypanosoma brucei gambiense type of parasite being the commonest in Africa, accounting for up to 97% of the sleeping sickness cases. The Western and the Central African regions are the most troubled. Unlike most of the bugs, the tsetse fly mostly attacks by daylight, and it's commonly found in the rural areas. Studies show that it is uncommon for the sleeping sickness to be transmitted from mother to child, or the sharing of needles and sexually. But it is not impossible. Presentation of the sleeping sickness is in two main stages, the first and the second. In the first phase, the parasite infests the blood, the lymphatic system, and other organs like the liver, lungs, the heart. As usual, the immune system will protect the body by attacking the parasites, which will react by mutating. It attacks again and they also mutate again. At this point, the main symptoms include itching, headaches, fever, and enlarged lymph nodes, reflecting the struggle that is happening between the immune system and the parasites inside the body. Sometimes these symptoms are too mild to be detected, but this is the point at which the disease is the easiest to treat. Then comes stage 2. The parasites invade the central nervous system across the blood-brain barrier. The disease is now more difficult to treat because the blood-brain barrier stops toxins, substances, along with medication molecules from crossing into the brain. In the second phase, things are getting real. Symptoms include sleeping disturbances at night, but then sleepiness during the day. If it's left untreated, it progresses to feeling sleepy all the time. And if no intervention is offered at this point, it leads to a coma. And then, due to the deterioration of the central nervous system, sleeping sickness eventually leads to death. Progression of the illness from the first to the second stage depends on the type of parasite which would have affected you. It takes a few weeks to progress from stage 1 to stage 2 when one is infected by the rhodiense type of parasite, which is relatively fast as compared to when infected by the gambiense type of parasite. With the gambiense type of parasite, it takes months or even years without even showing symptoms until you develop stage 2. If you suspect that you might be infected after traveling to the rural areas, a resort, or a game park where tsetse flies are, it is wise to visit your local health facilities. They will run some tests like the PCR, cut agglutination, among others, for diagnosis. Treatment of the sleeping sickness is difficult but not impossible. It depends on the type of parasite and the stage of the disease, with the second stage being especially difficult to treat. For prevention of the sleeping sickness, consider wearing covering clothing. This is important for tourists and people who would be visiting areas that are known to have the tsetse fly, because there is no vaccine or any sort of prophylaxis for the sleeping sickness. As underrated and neglected as it is, sleeping sickness can cause a significant negative impact on an individual's health. That's about it for today. I hope this video has been helpful. Do not forget to subscribe. See you soon.